Welcome to the State of Minority North Carolina Conference. I am Talitha Batts, Director of the North Carolina Institute of Minority Economic Development's Policy Center, located in Durham, North Carolina. During today's 2-hour conference, we will bring together community stakeholders, partners, and state government officials to discuss current information regarding key issues impacting equity and the challenges that continue to devastate minority communities. Our experts will cover the areas of healthcare and the impact of COVID-19, workforce development, small businesses, and economic development. In these areas, we will address many challenges as well as many opportunities. We have 7 dynamic speakers with us today. Mr. Kevin J. Price, Secretary Michelle Sanders, Dr. William A. Darity Jr., Dr. Pamela Howes, Mr. Cornell Wright, Dr. Viviana Martinez Bianchi, and Ms. Tammy Hall. I'm also joined by my amazing co-host and moderator, Ms. Lakeisha Freeman, General Manager of WNCU 90.7 FM, a station owned and operated by North Carolina Central University. Along with streaming live from the Policy Center's YouTube channel, you can also listen to us today on 90.7 FM WNCU. Now, we all have a lot to cover, and there's a lot of impactful information that you're going to hear today. And for those of you who need to hear it again or have questions, the playback will be available on the Policy Center's YouTube channel, our website, www.theinstitutenc.org, or send us an email to the Policy Center at theinstitutenc.org for follow-up information. Again, this session will be available on the Policy Center's various platforms for playback. If you would like to join our mailing list, please send an email to the Policy Center at theinstitutenc.org. And lastly, don't forget to hit the subscribe button on our YouTube channel. You don't want to miss our exciting lineup of events for 2021. Now that we've taken care of all of our housekeeping, let's meet our first guest and jump into presentations. We are extremely excited to have our very own President and CEO, Mr. Kevin J. Price. Kevin has only been with the Institute for 10 months and has managed to work my fingers to the actual bone. But I couldn't be more proud to be a part of such a thriving organization led by our fearless leader. Kevin, thank you for leading the Institute into the future, and we are excited to have you as a part of our panel today. Kevin?
Well, my pleasure. Thank you for the introduction to life. I need to have you on the road with me to do more introductions for me. And thank you, panelists. I really appreciate all of you, subject matter experts, Secretary Sanders, Director Hall, and Lakeisha. Our relationship with Central has been great, so I really appreciate that and look forward to more success with North Carolina Central University as well. So thank you all for participating. This is exciting for me. Our first State of Minority North Carolina Conference. And this is kind of a teaser for what's to come in August of this year, when we'll reinvigorate and relaunch our Executive Networking Conference. So I'm real excited about that. But I thought this was the right medium for us to at least talk about what's happened in 2020 and how it's impacted minority businesses and diverse businesses across the state. So I'm excited about today. And I've got a PowerPoint that I'm going to share. I know some of you may not be able to see it because you're driving, and that is okay. I will talk you through it, so don't worry. So this is an interesting time for us at the Institute. Many of you all know the Institute for a number of reasons. We've been around for almost 35 years now. This is our 35th anniversary this year. And for the last 30 years, we have been that organization that you've known as an advocacy organization that has stood in the gap and provided that voice, provided technical assistance for diverse businesses through our women's business centers and small business um, transportation resource center. So we've done a lot of work in that space. What's exciting now is adding to that additional resources with the addition of our merger with the North Carolina Community Development Initiative. That provides this financing resource for us to not only do the support we've always done, but now be able to provide financial resources. So I'm very excited about that. This is a growth mode for us. So most of us know us as being centered or concentrated in North Carolina, but we're growing beyond North Carolina into Virginia and West Virginia, Kentucky, South Carolina, and the Washington, D.C. area. So a lot of exciting things are happening at the Institute right now. And to put it in context, this is really an era of resiliency. Now think about that a minute. We have survived a pandemic. We have survived this economic downturn in the economy. We survived racial unrest, and we're still standing. Not only still standing, but we're thriving. And I don't want you all to think of this as we're just surviving, we're just getting by, because we're not. We are thriving in this environment. But now we got to look at more resources and more opportunities to grow even more and be stronger. And that's how we're trying to position the Institute, and partly why we have this conference this morning. But I wanted to give you some context and give you a little background about what the Institute has been up to before the subject matter experts come on and start sharing great information with everyone. We kind of started this journey early last year with Talitha coming on to reinvigorate the Policy Center. And she's done a fantastic job there. This is a prime example of some of the work she's been doing. And we've done all of this virtually because we've been at home since March, working virtually, like many of you, trying to protect our team and make sure we are around and healthy to take care of you. We've been gathering data and intelligence that we can share with elected officials across the state, those who are responsible for corporate responsibility and philanthropy. We wanted to share information with them about how the pandemic and the downturn in the economy has impacted diverse businesses across the state. And we've shared that through town hall meetings. We've expanded resources by merging with the initiative. And then we've charted this new direction for the Institute, and I'll share a little bit about that in a minute. We also brought in some additional support with a previous team member coming back to the Institute to help us with our messaging and marketing and communications. So a lot more to come from that. And I hope you all like the graphics because that's all her. Vanessa Nicholas has done a great job with just presenting us well. And I appreciate that. Resources has been incredibly important. One of my old bosses used to say, a dime can't tell a dollar what to do. You can have all the advocacy in the world you want, but if you don't have financial resources, it's very difficult to turn that tide. So we have to find the resources to support businesses so that they can continue to thrive and keep those jobs in place. And we're very happy about the relationship we've had with the North Carolina Hub Office. Director Hall has done a great job there, along with Secretary Sanders, of finding resources for us to support diverse businesses across the state. We put $7 million on the street to support businesses, over 350 businesses. So I'm real excited about that. And now we're launching this capital campaign so we can grow our resources and be even more effective for those of you who need additional resources. So if you were to look at the Institute on paper now, this is what we look like. Our mission, vision, and values are clear. We're here to strengthen the asset base of diverse populations through policy, education, and economic opportunities. But what's really changed about this is these lines of business and how we're organized to support one another. That's the only thing that's really different about us. And why is this important? It's really important because you all have seen the headlines of how last year we lost 40 to 41% of just African American businesses nationwide. And I was asked recently, well, what do you think that means for North Carolina? I say, well, we're probably on parity with that in North Carolina. So we've got to do a much better job of finding resources to support our diverse businesses across our state. But not only that, we've got this pandemic that we're dealing with as well, and jobs are being lost because of that. So this really gets to the heart of economics and how we support businesses so that people can support themselves. That's really what this is about. And so we will be doing several things next year, but we've got to now look back at some of the data we collected this past year so we know how to go forward. We convened a group of nonprofits representing different sectors of the community last year to really start to hone in on just how this pandemic and downturn in the economy has impacted diverse businesses across the state. It revealed some interesting things for us. We found that out of the more than 1,000 responses we received from our surveys, most of the companies that responded were sole proprietors. Most of them had fewer than 10 employees. So these are very small businesses that we're talking about here. And over half of them have been in business for at least 5 years. So they're not startups. These are not new businesses by any means. They've been in the community, they've been producing in the community, and we need to protect them and make sure they have the ability to grow. 88% of them had experienced a loss of revenue, which I thought would have been higher than that. But we know that we've seen our headlines of how we've lost businesses, but believe it or not, there have been businesses that have thrived in the pandemic. They've learned how to pivot, learned how to shift their business model, and grown in the last year as well. So we're proud of what they've done. 80% are still operational. And that number worries me because what about the 20%? What happened to them? And how can we fill that gap? Because that 20% represents jobs that have been lost and an impact to the economy of North Carolina. And then 66% have not experienced layoffs. So they're trying their best to hold on to employees and keep them engaged. And we saw this represented different sectors of the community. It wasn't just in one particular industry. It was fairly well balanced in terms of health and human services and consulting, professional services, education. These companies represented all types of industries. So I don't want y'all to think it was just isolated to one industry because that wouldn't necessarily be an accurate reflection. We also know that, if y'all recall, the SBA came in first with resources back in the spring, and we know that 30% received some SBA funding, which I thought was quite low. And we've heard some of the reports of how many minority businesses felt locked out of that process. And thank goodness the state responded with its own resources that we could put on the street. But that came later in the year. So companies had to survive until the fall when new resources were developed and identified. So we know we have a lot more work to do in the state. Some real cool discoveries that I wanted to share with you all was one of the things we were hearing was that most of the early assistance was loan driven. And what I was constantly hearing from small business owners across the state was, let me make sure I get this right. You know we've lost revenue, and you want us to repay a loan based on lost revenue. How does that work business-wise? We need more grant money. And the state responded with grant sources to shore that up. but 43% hadn't applied for any type of assistance at all. Some of that is because of distrust. Some of that is because even though you may have had a bank account, you didn't necessarily have a banking relationship. And it's times like this when we have these dire economic downturns where those things really are highlighted. So I would encourage you, if you own a business, you need to have a banking relationship, not just a bank account. And then 58% hadn't applied for any loans that were available at all. Some diverse businesses shifted their models by reinventing themselves. And we talked a little bit about that earlier, but I was encouraged by that. And then there was this renewed community interest in supporting businesses of color. And we tried to help with that. We created a web page that we call Marketplace, where you can go in and search for businesses in your community that you want to support. And that was our way of supporting businesses statewide. So what's on the horizon is we know that in order for our economy to truly bounce back and be strong, we can't just focus on large businesses and large corporations. Everything happens on Main Street. So we've got to support those small businesses, and diverse businesses will be key to economic recovery for North Carolina. And so for what's next for us will be, I want to encourage you all that we are going to make it out of this crisis. This is not about a calendar year. I've heard a lot of people say, well, we're in 2021 now, it's over. It's not over. You need to protect yourself. We still have an active pandemic. So protect yourself. Don't let your guard down. We have to address sustainability and how we shore up diverse businesses so that we can shore up the economy in North Carolina. And then we've got to act. In many ways, we have to act. We have to support those local businesses in our community any way you can. So we've got a lot happening at the Institute as we celebrate this 35th anniversary, and there'll be more to come in the future, but I'm going to pause there because I think I've taken a lot of time and let the subject matter experts share with you some of the great work they've discovered in this process. So thank you all.
Thank you so much, Kevin. The Institute has definitely been working hard over the past year, and I'm sure myself as well as everyone else is excited to see what's coming in 2021. Thank you so much. Our next guest speaker, Secretary Michelle Sanders, was appointed by Governor Roy Cooper as the Secretary of the North Carolina's Department of Administration on January 12, 2017. Secretary Sanders, a native of Belhaven, North Carolina, brings to the Cooper administration experience in both management and leadership. A mother of twin daughters, she is passionate about improving the status of women in our state. As she clearly puts it, improving the status of women in North Carolina is not just a woman's issue. This is a family, poverty, and economic issue. Secretary Sanders is also a strong supporter of diversity and inclusion and is currently the chair of the North Carolina Commission on Inclusion, the North Carolina Complete Count Commission, and the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force. Secretary Sanders, thank you so much for joining our panel today.
Thank you, and I appreciate the opportunity to be here with everyone today. And thank you very much for having me to be a part of this. Today is a great day, and I woke up even more energized than I did yesterday, just looking and hearing the results of Georgia. So I have to say, today, like every other day, should give us hope, but today really gives us hope about the work that we can do in North Carolina and in the South, and specifically for our minority businesses. So good morning to everyone. I thought it would be appropriate today to share with you the latest news on the work of the Andrea Harris Task Force, as Ms. Harris not only co-founded the Institute of of this, of course, everyone I think is familiar and knows that. But she was also one of the state's greatest champions for equity, diversity, and inclusion. So it is an honor and a privilege for me to chair this task force, which the governor endorsed and created with an executive order. Andrea Harris was a dear friend and a thought partner to many, and served as an inspiration to those of us addressing racial and equity, social equity, and justice issues in state government and across the state and beyond for that matter. She was a passionate leader and an advocate for North Carolina and its people. You know, Ms. Harris dedicated her life to eliminating disparities in North Carolina. And I'm so proud of the work that she did and has imparted on us. And her legacy lives on. We have more work to do to be a part of furthering and champion that. So the Andrea Harris Task Force was established. It is focused on social, economic, environmental, and health equity. And this past June, that was created, and we began to do our work. That work was initiated and the task force was created because of the disproportionate impact that we have seen on people of color with COVID-19. Our communities of color have been impacted significantly in so many ways. It's been devastating for the nation and surely so for the state. There's very few people who you talk to who don't know someone or have someone in their family or friends arena who have not been touched by COVID-19. And let me just say here, my heart goes out to all of those who have been impacted and to all of those who have lost loved ones as a result of this awful pandemic and illness. These inequities that we've seen are certainly not new, but the pandemic is worsening their impact and bringing them into sharp focus. 22% of coronavirus cases are among Black residents, while 27% are among Hispanic residents, according to the latest data from North Carolina Department of HHS, and that is ever changing, so it could be even more significant now. We want to focus on the root cause of the disparities. We want to focus on the root cause of the outcomes that we are seeing. And we want to focus on the root cause of this unsurprising data where there is a disproportionate impact of COVID-19 on communities of color. I emphasize unsurprising because it should be no surprise to anyone with the disparities and inequities and the injustices that we have seen for, I was gonna say years, but frankly centuries, that these are the people who look like me, who are most impacted. The task force is made up of 5 subcommittees and a business engagement group. And those 5 subcommittees are access to healthcare, economic opportunity and business development, educational opportunity, environmental justice and inclusion, and patient engagement. The task force and its subcommittee have been meeting and hosting public listening sessions, developing policy recommendations since the summer. And just last week, the task force released the first biennial report. I said last week, it was actually last month now, to Governor Cooper. And so Governor Cooper has received that body of work. A small group of us will be meeting with him about implementation and support for those actions. And recommendations were put forward to help create economic opportunity, eliminate health disparities, and achieve environmental justice for a stronger state. The recommendations that were put forward include expanding Medicaid, increasing opportunities for patients to use telehealth services. I think you heard Talitha mention that I'm from Belhaven, North Carolina. If you know Belhaven, you know it's a small town with an Andy's, a Hardee's, and maybe one stoplight in town. But you know, it's also a town that struggles and has that digital divide, if you will, and many people are not accustomed to telehealth services. My mother is here with me and was a little bit in awe when we had our telehealth appointment with her cardiologist. And so I can see and I know firsthand what it means to have loved ones or to be without those services. Increase in investment in rural hospitals, another recommendation, and community health centers and those federally qualified health centers. Providing incentives to corporations to support our hub program and attain specific metrics for supplier diversity. Let's make businesses more inclusive and accountable. Supporting workforce development programs and leveraging partnerships with North Carolina HBCUs and community colleges to develop executive educational programs and create medical school pipeline for students of color. This is vitally important as we go forward to working in the community. We want to have the workforce ready to go as we continue to grow our economy. Supporting the creation of environmental justice, equity, and inclusion positions across state agencies is a recommendation that was put forward. So all of these recommendations, we believe, will have an impact, will make a difference, not only across state government and organizations and entities in state government, but most importantly to all the residents of this state. Now, to dig a little deeper into this, expanding Medicaid, let's hit on that for just a moment. Expanding Medicaid is one of the primary and most urgent goals of the task force. North Carolina, I have a cat in the background that's competing with me, and I think somebody needs to put that cat up for me. The most urgent goals of the task force, one of them is Medicaid expansion. North Carolina is one of only 12 states that has not expanded Medicaid. Only 12 states. Medicaid expansion can not only boost our economy, creates thousands of jobs, and expands access to affordable health care, but research has shown that states that have expanded Medicaid are better positioned to address COVID-19, the economic recession. It will also importantly address the health and well-being of those who are caught in this awful gap. People who don't have sufficient insurance, the majority of the time are people who are working and they don't make enough to qualify or to pay for the marketplace insurance, but they don't qualify for Medicaid expansion, Medicaid either. So they're caught in this gap. We have people working 1-2 jobs who do not have healthcare coverage. As a matter of fact, 500,000 in North Carolina. This is something that is passionate and near and dear to me, because if we don't have our health and well-being, what do we have? What can we do? We can't work many times. We can't provide for our families. We're struggling and making choices about whether to put food on the table or whether to take the medicines and get the medicines that we need. So this is something that is vitally important. Telemedicine and broadband access, which I mentioned as a recommendation, this goes hand in hand with the need for greater access to broadband connectivity and telehealth services. And I gave you an example. Prior to the onset of the pandemic, a digital divide in North Carolina exposed the gap between those who have access to technology and internet and digital literacy training and those who do not. Today, with our school systems having to revert to remote learning in many places, it has clearly highlighted the haves and the have-nots. So according to the Federal Communication Commission, only 59% of North Carolina households have the download speed necessary to meet the common needs of the network users, like checking email or researching a topic on Google. I mean, just to connect to the basic rest of the world that we take for granted at the tip of our finger on our iPhone or whatever it is that we have. That means more than 40% of North Carolinians households lack the level of internet connection needed to effectively work, to attend school, or to see a doctor from home. And those same individuals, people may also not only lack the access to see a doctor, but lack transportation and funds for transportation to get to see a doctor. In the best of times, this lack of affordable and accessible broadband is a distinct disadvantage. In our current pandemic environment, it is crippling. It has crippled our communities. So yes, the task force is recommending that the state appropriate funds in our Office of Rural Health and Health Information Technology for assistance programs to continue to work to help North Carolinians get primary care safety net of providers, offer them telehealth services. Federal funding for the programs end in September of 2021. So we need this money. Our people need this money. And frankly, a lot of the things that we talk about, including Medicaid expansion and broadband access, we sometimes think of it affecting just those populations that do not have it. But for me, it's a public health issue, meaning it touches all of us in many ways, including our health. The third point I want to dive into a bit is hub participation. The task force is also recommending that the state review innovative opportunities to encourage hub participation for our historically underutilized businesses, such as economic incentives for companies new to North Carolina and those that are here. Our director of our hub office will be, I think it's here with us today, and we'll speak in Ms. Tammy Hall. And I know that Mr. Price has been a part of the conversations about our economic stability and closing those disparity gaps. According to 2012 census, there were more than 180,000 minority businesses in North Carolina. And the Hub Office has certified more than 4,500 as historically underutilized businesses. However, businesses by people of color and other minority groups have been historically excluded from economic opportunities. I am pleased and proud to say that I'm a part of an agency and an organization and team that advocates for these businesses, advocates for inclusion, advocates for opportunities and for economic growth and prosperity for these businesses. Retool NC is one of the recent ones that I think Mr. Price mentioned, that we were proud to partner with the Institute and Carolina Business Fund to get those funds out in the street. We are requesting and hoping to receive more. We can do more, we need to do more, and we are eager to do more. So in addition, the North Carolina Department of Administration Office of Historically Underutilized Businesses has a new disparity study that has been released. This is the first disparity study in more than a decade that government agencies will get the insight to determine if access to government contracts is unfairly denied to minority and women-owned business firms in the marketplace. With this disparity study, we will be releasing to the Economic Opportunity and Business Development Subcommittee that body of work, and will continue to work with the Hub Office to review, study, and identify, and hopefully implement policies or legislative needs for recommendations out of that study. So this year has been a year of great learning and collaboration for the task force. And I encourage you to visit the North Carolina Department of Administration website to see the full report and find out about upcoming public comment meetings. All of our meetings are public meetings, and submit your feedback and recommendations that you may have. The next steps for the task force include implementing on our plan for our policy recommendations, We will host additional public comment sessions to get public input and on those implementation plans. And we also want to engage the subject matter experts across the community. No one person can do all this work, nor can one task force or entity. So we're looking for and eager to partner with others to help bring these implementation plans and actions to reality. The task force and I will continue to carry the torch for Ms. Andrea Harris and to fight for greater equity, inclusion, and diversity, and to help amplify the voices of many of you and other advocates across the state, and also to serve as a voice for those who may feel that their voices are unheard. I'd like to share something with you that a friend shared with me, a prayer written by a mother of two in Seattle, Washington, to help cope with during these difficult times, their pandemic. And there was just a few thoughts to take with us as we return to our lives, our communities, and our work that we have been given to do. And these thoughts are for the times of a pandemic. May those of us who are merely inconvenienced remember those whose lives are at stake. May we have no risk factors. Remember those most vulnerable. May those of us who have the luxury of working from home remember those who must choose between preserving their health and making their rent. May we who have had to cancel anticipated trips remember those who have had no safe place to go. May we who are losing our margin of money in this tumultuous economy, whether that's in the stock markets or 401, whatever it is, remember those who have no safety margin at all. May we who settle into our quarantine at home remember those who have no home. As we remember the winter, which is here now upon us, and our holiday season that passed, and as we go forward, let us reach out to one another. Let us reach out to others. During this time, we cannot physically wrap our arms around each other. And, we find ourselves, have to find other ways to embrace our families and embrace those in need, whether that's virtually or whatever that way is. But we have to remember that there are many who are struggling. Our numbers are scary, and it can feel like we're helpless in the face of a pandemic. But we actually have very effective tools and ones that can protect us. Wear a face covering, wait 6 feet apart from others, wash our hands frequently, regularly, especially when we're returning to home. And we will, as Mr. Price mentioned, we will get through this. And, if I had something here that I just wanted to say about just today, because, I was excited. I'm kind of a little political junkie and wonk. But, I think that today, the results of the election in Georgia gives us hope, regardless of what your party affiliation is. It gives us hope. Because, in my opinion, a woman who cavorted around with Ku Klux Klansmen and the racist 45th president, with all the suppressive schemes and lies that she and others thought that people of color were going to just let that go without exercising our right to vote and our full right to American citizenship. After all, we've been through, especially recently, and all of us, especially knowing the shoulders of whom we stand on, people like Andrea Harris, people like John Lewis, and others, some who are on the call with us today. Today, the Black son of a woman who picked cotton, is going to the US Senate in his historic election to win as the first Black US Senator from Georgia. And I now hope that people will get it real clear what people like me, who's thought of as a radical liberal, as his opponent said, do. And what we do is we continue to work even in the face of adversity. And we continue to stand for equity and inclusion, not just for some people, but all the people. And the way to do that, one of the most powerful ways, other than to vote, and there's a few other things, but is to help our businesses thrive, our small businesses, our minority-owned businesses, help them to thrive. The absolute blood, sweat, and the tears that I know that Stacey Abrams and so many other remarkable revolutionaries have endured today against many forces like voter suppression, which we know in North Carolina is alive and well, that we have to continue to work and to really continue to focus on our futures and to bring about greater hope for all the residents of the state. And especially at this time, people of color who are dying as we speak and struggling for their next breath. That is why the Andrea Harris Task Force was created. And that is why the work we are doing and your input and support is so important. It is a matter of life and death. It is a matter of life and death for people of color who have been disproportionately impacted. It is a matter of life and death for your community, my community, and for this state of North Carolina. And it is a matter of life and death for you and your families and your children for generations to come. So I have no choice but to do the work, whether it's in this role or in another role. And you have no choice but to stand up and do the good work that you're doing and to continue. I want to thank Mr. Price. I want to commend you and the Institute for continuing to do great work and to putting forward programs like this. And thank you all for your time, and sincerely appreciate you joining and partnering with the task force as we continue to do the great works and carry on the name of Ms. Andrea Harris. Thank you all and have a great, happy New Year.
Thank you, Secretary Sanders. Your passion to help improve the lives of North Carolinians is evident, and we appreciate your commitment to the people of North Carolina and everything you do. Thank you so much. Our next guest speaker, Dr. William A. Darity Jr., or as we lovingly call him, Sandy, is the Samuel Du Bois Cook Professor of Public Policy, African and African American Studies, and Economics, and the director of the Samuel Du Bois Cook Center on Social Equity at Duke University. He is also the founding director of the Research Network on Racial and Ethnic Inequality at Duke. Dr. Darity's research focuses on inequality by race, class and ethnicity, stratification economics, schooling and racial achievement gap, North-South theories of trade and development, skin shade and labor market outcomes, the economics of reparations, the Atlantic slave trade and the Industrial Revolution, the history of economics and the social, psychological effects of exposure to unemployment. His most recent book, co-authored with A. Kirsten Mullen in 2020, is titled From Here to Equality, Reparations for Black Americans in the 21st Century. He's also published over 13 books and published over 300 articles in professional outlets. Dr. Darity, it's always a pleasure having you, and I love that whenever I call you, you always say yes. So thank you for being a part of the panel today. Dr. Darity.
Thank you. I'm honored to be on the panel today. I'd like to thank you and thank Kevin Price for the tremendous leadership that you've provided for the Institute. I'd like to make two observations at the outset. The first is that we're accustomed to thinking about Black business development as a source of Black wealth. I think that we also have to think about the reverse relationship, which is prior wealth is the pathway to Black business development, both in terms of survival and expansion. The capacity to take on greater risk, to be able to extend one's operations successfully, to acquire additional credit, is frequently contingent upon having wealth in the first place, and the extraordinarily low levels of Black wealth constitute a major barrier to Black business development. The second thing I'd like to mention at the outset is that my remarks are going to focus on national policies rather than state level policies. And this is not a recipe for state level paralysis. In fact, in the meantime, before we have the types of policies I have in mind being adopted, I want to echo Secretary Sanders' call for the expansion of Medicaid in the state of North Carolina. However, the central problems that have been exposed by the pandemic are problems that cannot be solved exclusively by actions that are taken at the state level. We need federal action. We need a transformative nationwide program of action. And this transformative program of action is one that would have been extremely valuable to have in place at the outset of the pandemic. What we need is an economic bill of rights for the 21st century for all Americans, and a reparations plan for Black American descendants of US slavery. If we had had these things in place, we would have been better able to cope with the current crisis, and we would be prepared for future crises. Three elements of the economic bill of rights for the 21st century that I'd like to highlight today are the federal job guarantee, national health insurance, and universal access to Wi-Fi. A federal job guarantee is a right to public sector employment for all adults at non-poverty wages, with benefits similar to those received by all federal civil servants. If such a program had been in effect, we would have had an existing public payroll, and it would have been easy to move people who had lost their jobs onto it. Moreover, the federal government could have borne the expense of safety protocols to better maintain public sector employment. Artists and entertainers who no longer could tour or benefit from public gatherings could have been employed under the federal job guarantee in a fashion similar to what was done with the Works Progress Administration in the 1930s. It also would be possible to rejuvenate rather than destroy our battered postal system by mobilizing employees from the federal job guarantee. In the process, we could restore a postal banking system to undercut predatory lending. A federal job guarantee would also provide the employment base for the construction of the infrastructure to support a green economy. A national health insurance program would establish a right to access to medical care for all Americans. No one would be without coverage. The connection between having a job and having health insurance would be broken, and crucially, the dollar sign would be taken out of needed medical care. Not only would the presence of the National Health Insurance Program have been valuable in grappling with COVID-19, it would again make us better prepared in the event of a recurrence of a similar type of emergency. Moreover, the Economic Bill of Rights of the 21st century also should include a right to free broadband services for everyone. This would mean universal access to the internet and to the machinery, whether it's a laptop or a smartphone, for making use of the internet. Such access is vital in a context where barriers to social interaction are required, particularly in a phase of the crisis where disruption in classroom-based instruction at all levels of the educational system are taking place. It would also expand the possibilities for adults beyond the schooling years to work more safely on a remote basis. And how different would our world be today had reparations for Black American descendants of US slavery already have been enacted? While the programs listed above are something that I'm placing under the aegis of a universal platform of economic rights for all Americans, elimination of the nation's glaring Black-white wealth disparity will require a race-specific plan for reparations. While African Americans constitute about 13% of the nation's population, they possess a mere 2.5% of the nation's wealth. This small share corresponds to a condition where, according to the 2019 survey of consumer finances, the average white household has a net worth $850,000 greater than the average Black household. 4 white billionaires, Jeff Bezos, Bill Gates, Mark Zuckerberg, and Michael Bloomberg, hold more wealth than 80% of Black Americans. Still, the racial wealth gap is not solely a matter of there being a handful of extraordinarily rich white billionaires, although there are indeed a handful of extraordinarily rich white billionaires. But 97% of all white wealth is held by households, white households, with a net worth above the white median. And 1/4 of white households possess in excess of $1 million in net worth, in contrast with only 4% of Black households. Closing the Black-white wealth gap would necessitate a national expenditure of at least approximately $11 trillion. The Black-white wealth disparity effectively captures the economic impact of the full trajectory of racial injustice in American society from slavery to the present moment. The health effects are palpable before the pandemic. They are devastatingly tangible in the midst of the pandemic. Black employment has been disproportionately concentrated in jobs that require personal services and personal contact. And this has meant jobs that are not deemed essential have vanished during the course of the health crisis, costing Black workers employment and income. For example, data from the Current Population Survey's labor force statistics indicate that Blacks constitute close to 30% of all barbers, about 25% of couriers and messengers, close to 20% of all childcare service providers, clothing store workers, and traveler accommodation employees, all lines of work sharply curtailed by the pandemic. On the other hand, Blacks also have been disproportionately concentrated in low-wage jobs that are deemed essential, thus putting them at risk for greater exposure to the coronavirus. CPS data indicates that Black workers are about 30% of transportation workers, 22% of animal slaughtering and processing workers, and about 25% of healthcare and hospital service providers. Black American adults face both greater odds of losing jobs, but if they are able to continue to work, greater odds of exposure to the deadly disease. As the economist Rhonda Sharp has pointed out incisively, performing essential work does not mean that the persons performing that work are considered essential. Jobs may be designated essential, while people performing the jobs may be treated as disposable. Indeed, Black workers who contract COVID-19 have greater vulnerability to mortality and morbidity from the disease. This is because Black Americans generally are more likely to have pre-existing health conditions that predispose them to particular susceptibility to the coronavirus. And these include diabetes, obesity, and hypertension, as well as related cardiovascular diseases. But there is a fundamental underlying pre-existing condition, the critical comorbidity, which is the absence of Black wealth. Lower wealth is strongly associated with poorer health, and it makes it more likely for Black workers to lose jobs during an economic downturn, whether produced by the business cycle or by a pandemic. Lower wealth makes it more likely for Black workers to have to stay on essential jobs despite the low pay and a higher degree of danger. Lower wealth generally makes it more difficult for Black households to adjust to emergencies connected with unexpected income losses. It has become a cliche to say every crisis creates an opportunity. In this case, the opportunity existed long before the crisis. If the crisis spurs the nation finally to adopt bold transformative policies, an economic bill of rights for all Americans, and a reparations program for Black Americans who were descendants of US slavery, then it becomes possible to shape a new future. And then COVID-19 will prove to be both tragic and beneficial. Thank you.
Thank you, Dr. Darity. It's always a pleasure having you on the panel, and you always come with the numbers. So we enjoy hearing your information every time. At this time, I am going to turn it over to my co-moderator, Ms. Lakeisha Freeman.
Thank you so much, Talitha. This is definitely an esteemed honor and pleasure to be a part of this great presentation today and to introduce the next presenters today. We have Dr. Pamela Howes, also Cornell Wright, and also Dr. Viviana Martinez Bianchi. However, first, we will begin with Dr. Pamela Howes. She is a teaching assistant professor at North Carolina State University and leads the apprenticeship and work-based learning initiatives at Wake Technical Community College. Previously, she led the National Fund for Workforce Solutions efforts to expand the apprenticeship and work-based learning. Prior to joining the National Fund, she was the statewide Director of Apprenticeship, Business, and Veteran Services for the North Carolina Department of Commerce. Without further ado, Dr. Howes.
Hello, everybody. Thanks for having me. I came on board at Wake Tech in September of 2019 to really lead some impressive work with the Wake County Board of Commissioners. So we're really working on Wake County workforce development through apprenticeship programs and really reaching out to underserved communities in Wake County to recruit people into that program. We're not quite a year into that work yet, but we are starting to see some really good results as we work with our community partners and other nonprofits in Wake County to start this initiative. We know in Wake County that there is a very big skills gap. We have a supply of technical workers that's not really keeping up with the demand of our employers in Wake County. And so we really wanted to work with our employers to recruit underserved, underrepresented populations into apprenticeship programs at Wake Technical Community College so that they could really forge a pathway for better economic prosperity. We also know that we have a mobility gap in Wake County. We rank 95th among 100 of the largest metro areas in North Carolina in economic mobility. So we know that we have individuals and families that are really struggling to achieve the upward mobility that they need with career sustaining wages where they can feed their families and pay their rent or their mortgage. And so we know that apprenticeships ensure a direct pathway to the workforce. And so we are really working hard to get people in the 22 to 35-year-old age range who maybe are floundering. They weren't able to go to college out of high school. They maybe didn't even graduate from high school, but to get them into a sustainable program at Wake Tech to get them good employment with sustainable wages. So our apprenticeship program is an earn as you learn model. When our apprentices complete their training at Wake Tech, they are actually employed with an employer in Wake County. They earn a national credential. It's called a journeyman credential. We start with the basics and they learn the job from the ground up and they earn as they learn. So as they make progress at Wake Tech and in their job skills, they receive a progressive wage, which means they get steady increases throughout the period of time that they're employed. We're using the registered apprenticeship model that requires a minimum of 2,000 hours of on-the-job training and 144 hours of related classroom instruction at the college. Apprenticeships can last longer than that, but this is the minimum requirement as regulated by the U.S. Department of Labor. We know that when people finish a registered apprenticeship, they have an average starting salary of $50,000. The good news about our employers that are hiring our apprentices is they also have benefit packages with health care and other benefits like 401k retirement plans. We also know that an apprentice throughout their career, if they finish a registered apprenticeship program, that they can have in excess of $300,000 more over the life of their career. I always tell our apprentices, this is a great way to really save for your retirement and put money in your 401k. So the way WakeWorks works is we're providing tuition fees, books, and tools to our apprentices. If they need tools for automotive technician, we're helping to pay for those. We're helping to buy their uniforms if they need them. We have a first cohort of EMT apprentices. We bought their uniforms, their jump bags, their boots. So really trying to help people who maybe are stuck in their career in a dead-end job, find a way to really have economic mobility and better themselves and their families. So we currently have 200 apprentices at Wake Tech today, but our goal is by the end of 2021 is to add 500. I will tell you that it's been a tough project with COVID. It's definitely caused a lot of interruptions for us, but we are making progress. We are moving forward. We are adding students into apprenticeship programs, and we're continuing to add employers who are willing to sponsor our students and to give them an opportunity to interview for a job with them at the end of the day. And these are employers that pay very good wages and have very good benefits packages. So we really want increased levels of employer and student participation. We're really working hard with our community partners to include women and underserved populations. We're actually advertising for the program at social services and other community organizations like the City of Raleigh Career Pathways program, because we know the people who are utilizing those services are probably the ones that are most in need in Wake County and could really use the benefit of a program like that. So last January, the Board of Commissioners in Wake County voted unanimously to fund WakeWorks apprenticeship. We've been doing employer training at Raleigh, the Raleigh Chamber on the reentry population. We've been working with the NC Works Career Center in Wake County to work on people who have been formerly justice involved to get them into the program. We don't have an application process because our community partners strongly felt that an application process would screen people out that really need to be in the program. And so we've basically taken people on a first come, first served basis. And we hope to be able to continue to do that for continued funding from the Wake County Board of Commissioners. These are just some of the occupations that we're working on: the EMT to paramedics, the apartment maintenance technicians. We're doing the 5G cell phone tower technicians. These are the techs that climb these enormous cell phone towers throughout the county to do repairs on them. And we're teaching these people to actually do the work and climb the towers and do that safely. So these are just some examples. We also have electricians, plumbers, carpentry, welding, and automotive technicians that we're working with. All of our automotive dealers in Wake County have a dire need for automotive technicians. And as you know, these are not the mechanics of the past. These are people who work with computer diagnostics on state-of-the-art vehicles these days. And so we're really working hard with our employers to get a great pipeline of workers to serve both the community and to serve our employers in Wake County. And this is just some of our community partners. And with that, I'll give you some time back because I know that we're running a little bit behind.
Thank you so much, Dr. Howes, for that wonderful information that you provided to us. Our next presenter today is Cornell Wright, the Executive Director of the North Carolina Department of Health and Human Services in the Office of Minority Health and Health Disparities. He is a subject matter expert around the areas of health equity and disparities, minority health, and community engagement. And I now turn things over to my fellow Eagle, Cornell Wright.
Thank you so much. Good morning and glad to be here. I am Cornell Wright, Executive Director of the North Carolina Office of Minority Health and Health Disparities out of the Department of Health and Human Services, where Dr. Mandy Cohen serves as our Secretary and Mr. Ben Money serves as our Deputy Secretary for Health Services. I want to echo the sentiments of all of our panelists prior to me and understanding that we are definitely in a pandemic, and the numbers that we see in terms of the effects on people of color and from historically marginalized populations has been very, very, very great, in a manner that has been very harmful for our populations. And so seeing the effects of these disparities that have been just so pivotal to our survival and thriving in communities has really been brought to the forefront and highlighted even more through this pandemic. So I won't bore you with the statistics, and as Secretary Sanders has already laid out for us, and Dr. Darity as well. But we do know that there are greater risk for people of color and historically marginalized populations. So we have to be mindful as we go and maneuver through these spaces of what we're seeing, what we're doing, and how we're reacting to these pieces. When we look at North Carolina as a whole and our minority populations, and understand that African Americans make up 22% of the population in North Carolina, and looking by race ethnicity, how the Hispanic, Latino, Latinx populations make up about 9 to 10% of the population. But we're seeing that these groups are suffering the greatest from the pandemic. We have to really make sure that we are providing the right resources in our communities, the right education in our communities, so that we can continue to protect ourselves, move forward, and thrive as we do so. Part of that has been the response on a statewide level to these issues. So I'm gonna spend just a couple minutes just laying out what we've been doing as a state in terms of how we've responded to this pandemic, in terms of looking at historically marginalized populations. So when the pandemic took place and kicked off almost a year ago now, the response of the state of North Carolina was to set up these work streams. And part of the work streams that we set up had 4 main pillars for statewide work. These consisted of prevention, testing, contact tracing, and wraparound services, which include isolation and quarantine support services. We figured out very quickly that the populations that are hardest hit really needed extra services. So we created sub-population groups in these work streams to really look at providing services to historically marginalized populations. And so we created historically marginalized population work streams, which included the first 4 of the prevention, testing, contact tracing, wraparound services, and then added 2 more, including behavioral health and procurement. Now, I know people may be scratching their head and thinking about, why is procurement one of the extra work streams? When we think about how we respond to crisis, we tend to fund organizations to go in communities and provide services. And when we look at who these organizations are, they tend to be the same organizations. So as a part of the procurement strategy, we need to make sure that we are giving opportunities to minority-owned businesses and organizations, minority servant organizations, women-owned businesses and organizations, to make sure that there's a form of equity, a level of fairness and making sure that the way we look at and address these issues is done in a way that's equitable. And the way we give out contracts or opportunities for organizations to be in our communities, we should have those organizations that have already been in the communities, that are trusted sources and connected to the communities that need the most help. So the part of the work of my office, in the Office of Minority Health, we have done just that and connected with vendors from the Latinx, Hispanic, Latino populations to work across the state. We had 5 vendors that we were able to fund through COVID, to work and be connected to communities to help promote testing and prevention messages, also contact tracing and wraparound services and behavioral health and other procurement opportunities, so that we can have more parity and equity in the work that we do. We also were able to fund some African-American vendors and also work with historically Black colleges and universities, especially Livingstone College, to work with communities, faith communities, and other organizations across the state to provide food security services to those greatest in need, especially related to COVID activities. And so that's important to understand the impact of how procurement plays a role in all of the responses we've been seeing with COVID-19, especially for historically marginalized populations and communities. When we look at behavioral health, there's just so much other information that we just don't have yet, but we do know and understand as we the needs for behavioral health services and mental health services, just simply by looking at just some of the data and understanding how some people have had to be isolated from family and friends, and then after effects that happen, especially in Black and Brown communities. Our historically marginalized population work streams really lean on partnerships across the state of North Carolina and outside of DHHS to really get a pulse of what's going on in communities. And it's important to make sure that those voices are lifted up and heard as we continue to move forward and provide resources, education, and understanding to our people and others, that we get a handle on what's going on. We understand that there are some questions and concerns about what we're seeing even now as the vaccine is being pushed out of health systems and local health departments, and what does that mean for our communities. And the biggest thing is to make sure that we're educated and informed, so that we can make informed decisions collectively and individually to respond to these opportunities. We know about the historic traumas that have existed in medical science in this country and beyond, and we don't want to repeat any of those mistakes. So we have to cautiously be prepared to educate ourselves, to make those informed decisions. And it starts by understanding what this vaccine is and what it is not. And so one way of understanding and getting better knowledge is going to your shot, your spot, your shot.nc.gov to really understand some of the frequently asked questions, some of the resources that are available, of understanding what we're seeing with vaccine. And some answers you just won't have, some answers you just won't have because of just the timeliness of these efforts and opportunities. But it's always good to make sure that our communities are educated and understand what is going on and how they can be involved. We are really hoping that we are continuing to adhere to guidances that are being put forth on leadership levels. And even though we do have this vaccine, we want to make sure that people understand the importance of the 3 W's or the 3 M's. And that is making sure we continue to wear our mask, continue to wait 6 feet, and continue to wash our hands as diligently as we can, because we are not out of the woods yet, but we need to make sure that we are continuing to adhere to those guidances, as well as the guidances of not letting people in our homes, and just being very mindful of how we maneuver in these spaces to not risk being infected or spreading infection to others. So I'll stop there, because we could spend so much time talking about this and so much more, but it's important to understand that we are responding and we are looking out for our communities, especially those that have historically been marginalized, and want to thank you for this time.
And thank you, Cornell. Thank you so much for that wonderful information that you have provided to us this morning. Next, we have Dr. Viviana Martinez Bianchi. She is a family doctor, a fellow of the American Academy of Family Physicians, associate professor and director for health equity at Duke University's Department of Family Medicine and Community Health. She is the executive member at large of the World Organization of Family Doctors and the liaison to the World Health Organization and chair of the Organizational Equity Committee. She is also co-founder and co-director of Latin 19, the Latinx advocacy team and interdisciplinary network for COVID-19, a multi-sector group addressing Hispanic health during the COVID-19 pandemic and beyond. Dr. Bianchi.
Thank you so much. I hope you can see my screen okay. Is it visible and you can hear me well? All right. Well, thank you. It's an honor for me to be here. And we'll talk a little bit about COVID-19 and the Latina community. This Latinx, Latina, la comunidad Latina, okay? North Carolina's Hispanic population is nearly 1 million. Just 1 in 4 Latino residents live in Mecklenburg or Wake County, and the next largest populations in Guilford, Durham counties. Now, interestingly, when you look at the whole state, you will see that the Hispanic population, even though it's smaller in more rural counties, many of these counties have seen faster growth in this population over the past 28 years. As a result, Hispanic or Latino residents comprise a greater share of the population in many less populated rural counties. In Duplin County, for example, 23% of residents are Hispanic. In Sampson County, 20%, Lee County, 20%, etc. Now, interestingly, many of these communities are linked to pork processing facilities in North Carolina. And you can also see that among the 150,000 farm workers and their dependents in North Carolina during the growing season, 94 of the migrant farm workers in North Carolina are native Spanish speakers. Poverty is an issue. Their average annual income is about $11,000 a year to live in the United States. The origin that's most represented is Mexican, but native births have overtaken immigration as the sustainer of growth within the US, the North Carolina community. The median age of North Carolina's Hispanics, Latinos is 23. The median age of Latinos born in North Carolina is 9 years of age. So you see, this is a young and growing population. So what happened when the pandemic arrived? We started seeing that if you start thinking about what factors lead to increased vulnerability, you will find that lack of clean water or sanitation, poor access to healthcare and basic services, food insecurity, being marginalized, living in overcrowded or working in overcrowded situations, being highly dependent on normal and economic daily wages, having weak systems of health and social governance, and conflict and violence are factors that will increase the vulnerability of our population. And what we look at, if you see how this affects our Hispanic community, our Latina comunidad in the state, you will have that it checks for poor access to healthcare and health services, food insecurity and malnutrition, being a marginalized, underserved community, especially in the issue of language, living or working in a overcrowded situation, and being highly independent on informal and economic daily wages. Another factor that sometimes we don't think about, our own country may not have a weak system of health and social governments, yet for the Latino community, the fear of the language especially, they enter the pandemic with this language of this otherness, of this blaming the immigrant, this ethnophobic systemic racism in many ways that was affecting them, and the fear of raids from ICE. So how did this affect cases in regards to COVID-19? As I said earlier, Latinos are 10% of the North Carolina population, and at this point, they're about 24% of all cases. But we found ourselves in about almost 50% of the cases at the beginning in May, in June, and July. And even though now it's about 20% of all cases, when we look at trends in regards to cases per 100,000 population, the red line is for Latinos, still going very high. Systemic racism, disparities, and COVID-19 have been seen as impacting Latino health. This comes from the National Institute for Healthcare Management, where the ways, policies, and practices, organizations, or systems, and I know I'm preaching to the choir here, have really affected the population. They have put them at heightened risk of contracting COVID-19. What factors put Latinos at high risk? The language barrier. The language barrier impacts health literacy and creates a barrier to care, to testing and treatment. We talked already about living in multi-generational homes. They're more likely to live in multi-generational homes where in those kind of units, it's difficult to take precautions to protect older family members or isolate those who are sick if the space in the household is limited. There may be one bathroom for 9 people living under one home. It is more difficult to follow steps to prevent getting sick with COVID-19 or to isolate if you do get sick. And then the immigration concerns. Individuals were seen to be reluctant to report infections, to seek care, a lot of fear about the public charge situation. Very proud families wanted to make sure they weren't utilizing the system and at the same time then being blamed for using health services and that counting against the possibility for immigration or for their immigrated status. Less than 1 in 5 Black workers and roughly 1 in 6 Hispanic workers are able to work from home. So we see this with the population. 16% of Latinos were able to telework. So that made them having to go to work, be at work, and be more exposed. The issue of crowded and working situations, working 8 to 10 hours a day without able to isolate determines the importance of rules for PPE use at work. I consider this not just a public health issue, this is the Department of Labor issue, where people should have the ability to have PPE in their work to decrease their exposure. We saw many outbreaks in meat packing plants, disproportionately affecting the health and the cases of COVID among the Latinos in North Carolina early on. Lack of transportation is also a situation. Often live in neighborhoods that are farther from grocery stores. They are far away from medical facilities, and it makes it more difficult to receive care if they're sick or they're living away. Other impacts are that they have been harder hit by the economic downturn. 49% of Latinos say that they or someone in their household has taken a pay cut or lost a job or both as a result of the pandemic, compared with 33% of all US adults. Immigrants and their family have limited access to COVID-19 employment benefits, partially because of being part of that less regulated economy. So increases risk of food insecurity and housing insecurity has been identified. They're less likely to have access to health insurance. Their lack of representation in the healthcare workforce contributes to language and cultural barriers to care. We are seeing right now that only of the people who have been vaccinated in North Carolina, only 4% are Latinos. And that also is partially determined by how small the workforce, the healthcare workforce is for the Latino community. There are not so many of us in healthcare. So how do we approach this hardworking population? One of them is identifying what are their factors for community resilience. We want to identify fears. We want to address housing and food insecurity. We want to address access to trusted, culturally and linguistically appropriate services. Do we have community health workers, Latino clinicians, school health programs, psychologists, people who is the community accessing for information? We want to promote prevention behaviors, work on the impact of the pandemic on children, diminish the economic impact, and address mental health. I want to resaltar, I'm thinking in Spanglish right now, I want to really pay attention to how important community resilience has been. Even before these groups were identified, and Cornell Wright was talking about procurement, how many Latinx community vendors were identified to try to work and be part of the system, they had already started doing foods of boxes. This was a picture taken back in May when La Semilla, for example, United Methodist Church group led by Pastor Edgar Vergara, was putting very necessary items in boxes and sharing boxes. By July, they had already given away 70,000 pounds of food to affected Latino families. These are some other leaders of different communities, and I was sharing before, this is El Centro Hispano. And many of these organizations have sprouted all over the state, really making a difference. We have to think about a syndemic orientation, this orientation of looking at what is the root of what's happening, how there was already a community affected by HIV, diabetes, depression, biological stress, violence, substance abuse, obesity, and now you add COVID-19. And what is the root to all of these confluent epidemics? And what happens with acculturation stress? How does it affect resilience? And what are the structural social drivers? And this is, somebody I consider an expert on this is Rosa Gonzalez Garda at Duke University School of Nursing. Research has identified that high level of acculturation stress interacts with the pandemic stress and makes it worse. Occupational discrimination, immigration stress, and pre-migration stress. A lot of these families are having to make the decisions to go back to their countries of origin, realizing that some of them had never lived in their country since they were children due to the well-known regulations with for some of them on DACA and some of them just being deported. So all of that creates a lot of stress. Traditional resilience factors of the community, this idea of families living together, unfortunately at this time is actually hitting against them. This big factor that helps the communities gain resilience goes against them. The other thing is what's happening in our hospitals. This was a lecture that we presented together with Yolanda Guzman at Duke University. This idea of identifying how were people disappearing into the system, families not knowing how whether their family member who had been admitted to a COVID unit was alive or dead because of not hearing. And so the importance of working with the intensive care units and those in there to realize that if there is language barriers, immediately you need to connect with your interpreters and work with them and connect with the family, because there's no one advocating for them inside it if there is no language. You want to help our health workers resist the dehumanization of people who are intubated and prevent the mistrust of all the community and all of the families. Going into the hospital was felt as a second, one more time, as trauma, as being separated at the border. You're getting separated from your family. You're being pulled apart from your family to be admitted to the hospital. So it created a lot of fear to going into the hospital. These are colleagues in obstetrics and gynecology, who created really important messages about the hospital being the safest place to go and deliver your baby in Spanish. So communities will understand that it was still safer to deliver your baby in the hospital, that you will not be separated from your child if you tested positive for COVID, which was a real disproportionate number of Latina moms were going into the hospital to deliver who had COVID during this pandemic. And then looking at workforce education, access to healthcare and patient care, and community and population health. Access in Spanish, our charts in Spanish. And this is work that we're doing with Latin 19 at Duke University, led by Dr. Leonor Corsino. And then again, working with our North Carolina Department of Health and Human Services. Many of you know them here in this picture, working with Dr. Betsy Tilson, doing messaging that reaches the community in the language that they speak. The media being some of our best allies, bringing us into having this conversation in Spanish for all to understand and hear. And then we see in Secretary Cohen an ally who understands the community, who has really promoted our voices and getting us into the places where we can be heard, where we can be understood, and where we can share and give information. Cornell was talking about it. You know, si sales de casa, recuerdas las 3 M's, doing language and information that is in the language. The campaign, cualquiera que sea tu razón, contesta la llamada, making sure that the people are hearing that. Again, I love seeing that in North Carolina, our government has become a trusted, or it has started to be a trusted member of our Familia Latina. Now, with the shot, the you have a spot and take your shot does not translate into Spanish. So we are doing a lot of information to try to figure out, llegaron las vacunas, vacunémonos, vacúnate, you know, doing really as much information as we can to actually get vaccinated. My arm is sore from my 2nd shot today, and I'm feeling really good. So when your turn comes, vacúnate. Cuando su tiempo llegue, vacúnese, take your shot. Latin 19, Salud y Bienestar, Health and Wellness for our Latina community is one of the things I'm co-leading. And it's not me, it's not a community of doctors, it's a multi-stakeholder organization of people who are coming in together to make a difference. And we wouldn't be this successful right now with all the things that we're achieving if it wasn't for our comunidad. An illness in the community requires a response in the community. Essential workers are the front line. If we are unidos, if we are united, we're stronger. We are many in the front line. And I'm gonna leave you with one phrase that I love. Indigenous and immigrant, together we stand tall. Our histories are relevant. An injury to one is an injury to all. A, this is for my book I love. A is for activists, from Innocento Nagara. And thank you so much for the opportunity to speak to you today.
And thank you so much, Dr. Martinez Bianchi, for that wonderful information that you provided to us this morning, and also the impact that it has COVID has had on the Latina community. Next, our final presenter today is Ms. Tammy Hall. Tammy serves as Director for the Office of Historically Underutilized Businesses, also known as HUB, and Assistant to the Secretary for HUB Outreach for the state of North Carolina. Tammy is responsible for developing policy and guidelines for the state's HUB program and is the authority in the field of minority business, development, and public sector, MWBE, and HUB programs. Tammy?
Good morning to you all. Lakeisha, thank you so kindly for that introduction. To the Institute, Kevin Price, your wonderful team. It is such an awesome pleasure to always be with you guys and partner in this work that we do here in North Carolina to support our minority and women-owned businesses. Well, you know what? It's a no-brainer for me. This morning, I'm feeling really, really good. I'm excited. I have hope. I have aspirations, and I know that North Carolina will be better as we move forward in 2021, and we drive this curve down by following the governor's directives to follow the 3 W's. We know what to do, we can do it, so that we all can come back together and hug and kiss on each other as we normally would do. So good morning, and thank you very, very much. Well, we heard from Secretary Michelle Sanders, Department of Administration, earlier this morning. And oh my goodness, did she energize me in preparation for this piece today. And you know, listening to each of you, each of our presenters this morning have shared information that is definitely going to help us moving forward. Into our listening audience, North Carolina is serious about the fact that we are open for business. We are open for business for all business owners. And I just so happen to have the great ability to focus on minority and women-owned businesses, which I truly believe are the backbones and the engines of our communities. When we talk about the various issues that we have in North Carolina, whether that's our health disparities, our educational disparities, our economic disparities. Well, for me, there is a common denominator in it all. Support for our minority and women-owned businesses. When their mothers, their fathers, their sisters, and their brothers have access to opportunities, guess what? It changes the outcomes for all of us. So I am always happy to be here and support the initiatives of the Institute. It is no secret as well to many of you that Ms. Andrea Harris was a dear friend of mine, and I followed her direction. I never asked questions. I always did what I was asked to do. And she was so very proud of the work that we are all doing to support minority and women-owned businesses. So when I look at government, and for me, this thing is full circle. I've had the ability to serve at the local level, the federal level, and now I'm back to the state level, as well as being in corporate. And the underlying factor in all of this is that we must support these businesses that are in our communities, that are helping to drive our tax base down, improving our schools, doing everything that's possible for our infrastructure. They're the key to our success. And when the governor talks about money in all of our pockets, okay, we get that by supporting our minority and women-owned businesses. So I do look to government to help to level the playing field. And I take it very seriously that we have a role here in this administration, in this particular state, to do all that we can to uplift these businesses. So you know what, now I think Kevin and others, I'll take a look back at some of the things the Hub Office has done to ensure that we are uplifting these businesses at all costs, as Ms. Harris would say, at all costs. Let's be at the table. Let's be a voice for the voiceless. Let's do what we know is the right thing to do. And we're worried about the repercussions of that a little bit later. So right now, we do what we know is the right thing to do. You know, for us to improve our economic stability, whether it's in government or in corporate, I do believe in 3 key perspectives. That is investing in an inclusive workforce, investing in an inclusive business environment, and investing in putting your money in communities of color. So when we have the philanthropic piece of it that goes along with those 2 other avenues that I spoke, then we will realize here in North Carolina that we truly are at the pinnacle of investing in our minority and women-owned businesses and supporting them. So for me, it's a no-brainer, as I said. We started out in this administration, Governor Roy Cooper, with about 2,100 certified hub businesses. We now, as of today, we're at about 4,800. My goal is by the time we end this administration to have 10,000 minority and women-owned businesses registered with the state of North Carolina. Because you know what? Even in a pandemic, we're buying things. We are consistent in our procurement spend, even when corporate, certainly does provide a space. But I tell business owners all the time, don't put all your eggs in one basket. Diversify. Have contracts in corporate, have contracts in government. Because one thing we can count on government to do is to continue to run, even in the midst of a difficult time. As we look at the pandemic, we have asked businesses to pivot, to retool, to come up with some new, innovative, creative ways to address COVID-19, whether that was now we see them preparing our face coverings, whether that's our clothing that we need. We have seen them really pivot and address these times. And so for that, we're most gracious. What can we count on minority businesses to do? We can count on them to be innovative and creative, to change to meet the need of time, and to do it at a low cost. So, in state government, everything is based on the lowest responsive, responsible bidder. How many times have we heard that? We've heard it enough that, you dream about it at night. The lowest, So we can count on our minority businesses to do just that for us. And so, for me, when I look at our cabinet agencies, there are no excuses. We all can find it within our operating budgets where we are buying things. We can all find the ability to reach out and develop a relationship with a minority business owner. And so we challenge our cabinet agencies to do just that. And not just our cabinet agencies, our hub program is throughout the state of North Carolina. We have 19 public institutions. We have 50 plus community colleges, 10 cabinet agencies, 10 support agencies, and they are all running a hub program, MWBE program, whatever you want to call it. It all means the same to me. Diverse business support for these business owners to get the job done. So it is a no-brainer for us. Not only have we increased our certifications in the hub office, but at the very onset of the pandemic, as we were trying to figure out what was going on, we had the foresight to build a relationship with SBA so that we could understand the funding that was coming from the government, from the federal government. And believe me, it was changing every day. And so it was quite confusing. So we built a partnership with SBA to ensure that we were hosting webinars. And we hosted 8 weeks of webinars, constantly making sure that minority businesses understood what was going on and how they could apply for, take advantage of the resources that were out there and available to them. We did that along with our state also issuing unemployment benefits. Our business owners did not know as sole proprietors, they could get the unemployment benefits as well. So our office opened up the gate to that line of communication. And we began to see some turnaround, but as Kevin indicated earlier, by the time the PPP was on the street, our business owners were still trying to figure out how they could build these relationships that were needed with corporations, corporate banks, to get in the door. And guess what? It was too late. It was too late. And so as a result of that, we went back to the drawing board with the Secretary Sanders and others in the governor's administration. And we said, we need an answer. We need a solution. And Retool NC began to form the first ever grant program for small businesses in state government. And let me tell you, we are extremely proud about it. It did some wonders. We have heard from our minority and women-owned businesses. It was a sense of survival for them. It was a grant opportunity for them to apply for, and it did not require them to pay it back. When you're in the hole already, how in the world are you going to pay back another debt? And we understood that. We heard from them, and we took action. This administration took action. And Kevin, we have been at the second round of Retool NC, and guess what? We out of money again. And so Secretary Sanders has mentioned earlier, we're back at the table asking for some more money because we know that business owners need it. You need it right now. And we are doing our very best to get it and give it to you. Now, I must tell you, one of the other things that I am most proud of, among many, to include that wonderful hub staff that I have that works with me, that works extremely hard. They never ask a question. They let me dream big and then they figure it out. So I so appreciate their help. But prior to Ms. Harris passing, there was one desire that she had. And that desire was that the state of North Carolina conduct a disparity study. We had not done so in over a decade. And if our listening audience knows anything about a disparity study, that is what state government needs to run a diversity program that is predicated on race. We needed that study to determine what does our available market look like. We've had a goal of 10% for a decade, and now it's time to look at, have our businesses grown? Should we be holding our cabinet agencies, universities, community colleges, should we be holding them at a higher standard? We needed the study. So we heard her. We heard her very loud and we heard her very clear. And so what did Secretary Sanders do? She put on her skills of partnership, negotiation, went to the table, and she found a willing partner in the Department of Transportation who said, I'll fund your disparity study. And voila, the money appeared, and we put our RFP out on the street, and we have conducted that disparity study. And as you have heard her say, the disparity study is complete. The study does not tell us anything that we didn't know. We already knew the answers, but we needed the data to substantiate what we already knew, and we have that. So I am excited to share later in the month and as we move along to roll out the study, to share with you the outcome of the study and to work, as the Secretary said, to implement strategies and policy and guidelines that help us drive to some real inclusive, intentional business opportunities for minority and women-owned businesses. So I am just delighted to be here. I'm at the end of the program, so I know you're all ready to leave and go into whatever other adventures you may have for today. So I'm not going to hold you up, but I just think it's important that when we ask and we reach out to say, are you HUB certified? I need for all of our minority and women-owned businesses to be certified, because we always get asked, what's the value? Well, the value is we spent $8 billion with a B, last year in goods and services. There are tons of people accountable. We need to hold them accountable that they are doing what we know is the right thing to do. So I'm going to end here, and I thank you all for allowing me to participate. You're doing a great job, and I look forward to working with each of you in 2021.
Thank you so much, Tammy. I enjoy hearing you speak every time, and thank you so much for that information. I know everyone else has now got the spirit and ready to do a playback and just listen to all of that over again, because it was a lot of information and very good information that we all need to know. So thank you so much for being on the panel. We truly appreciate you and your hard work. Now we are getting close to the end of our 2 hours. 2 hours goes by like that when you have this type of information and these people that are willing to present to you the information that we we've heard here today. So kudos to everyone. I'm going to turn it back over to our president and CEO, Kevin J. Price, so that he can give us some final thoughts of information as we wrap up our session today.
Well, thank you, Talitha. This has been amazing. The information has been rich, and I really appreciate all of you for participating. And for those of you listening, thank you for staying with us for 2 hours. You're right, Talitha, it does go by very fast when you have this kind of rich information. So thank you all. There's more to come, though. This is a teaser to ENC, the Executive Networking Conference in August, where we'll be back together in Pinehurst. And I'm speaking this into existence. We'll be post-COVID. So we got to speak those things. And you got to do the work now of making sure you get your vaccine. But we're going to be there together and talk in more depth about these issues and come up with solutions of how we can work together to get past these things for better North Carolina. That's what this is really about for us all, to provide opportunities for everyday North Carolinians to take care of themselves. I'm convinced people don't want a handout. They want an opportunity to take care of themselves and their families. And that's what we are, I think, fortunate enough to be in a position to do something about that. So we have a responsibility to do that. So I'm excited about the role that we all can play. I'm excited about the role the Institute can play in that process. And there's a lot more to come as it relates to that. We heard a lot of really cool things today. Some things stuck out with me that without your help, what do you really have? So that was really important. That's at the basis of all of this. You have to be healthy. And that's why we spent so much time talking about COVID and Cornell, the information he imparted on us and others, because it's important that you know that we got the research, we got the data. We now have to do the work to stay healthy and create a better and stronger North Carolina. So thank you all for the work that you've done to get us to this place. Thank you for your input today. Thank you for those listening for hanging with us and being a part of this incredible opportunity. And there's more to come in the future. Thank you all. And Happy New Year.
Thank you so much, Kevin, and Happy New Year to you and to all of our speakers. Again, thank you so much for your participation, your time, your energy in what you do every day, as well as your energy on the panel. We truly appreciate your participation. This concludes our 2-hour State of Minority North Carolina Conference with the Institute. And so we look forward to having you back with us again at the end of the year. We will have this conference again, and we will be reaching out. So thank you to all of you. For our listeners, if you are interested in submitting questions about any of the information that you've heard today, you can do so at our email. So you can send an email to the Policy Center at theinstitutenc.org. That's the Policy Center at theinstitutenc.org. We will also have playback of this conference available on the Policy Center's YouTube channel, as well as on the institutenc.org's website. So thank you so much. This concludes our conference.